Hello everyone. My name is Romila. I will share with you the field notes from Shadnagar Mandal, Ranga Reddy District. Bharat Dekho is a social organization conducting this field visit. Currently, we are visiting remote locations in Telangana to understand the condition of healthcare centers and people's needs. This visit was conducted on 10th July 2021 at Shadnagar Mandal. We will articulate our collective experience of the visit through this video. If you find this video meaningful, do share it with your friends and family. Before going into the details, let me tell you a little bit about the district. The district has 5 revenue divisions: Chevala, Ibrahimpatnam, Rajendranagar, Kandukur, and Shadnagar. There are subdivisions which are divided into 27 mandals. Mr. Amoy Kumar IAS is the present collector of the district. We started our first visit to a village called Tumpali, which is 20 kilometers away from the main town of Shadnagar. A majority of the people who are working here are either farmers or working in the industrial areas as laborers. On our way, we spoke to a woman called Vinoda. We asked her one question. We asked her, where does she go for a treatment? She immediately responded saying that she goes to a private hospital or an RMP doctor. When we asked her why, she responded saying that it is nearby and convenient and she knows the doctor very well. An RMP doctor is a doctor who is not a qualified doctor. He is an unqualified healthcare practitioner who is widely known as rural medical practitioner. The main role of this person is to do first aid and preliminary checkup, some diagnosis for seasonal diseases as well. They don't have the right to do any surgeries. The question here is, should should people go to an RMP doctor or a public hospital or a private hospital or not? That's not the question. The question here is that why do people believe in an RMP more than a qualified doctor who's working in a public hospital? Why is the public health institution unable to serve the quality that an RMP doctor who's an unqualified professional is able to serve? Where is the lack of mistrust? Where is the mistrust coming from among people? Now, we spoke to another woman called Pentama. She doesn't know anything about masks or corona. She said, in government hospitals, people are always rude to us. Hence, I prefer to go to a private hospital. She also mentioned something else. She mentioned that RMP doctors are also available 24 by 7, and sometimes they even provide door to door treatment to them. They live in a nearby village called Chaudarguda, which is very much accessible to these people. We spoke to a pregnant woman from Tumpali who reported that she gets milk, eggs, rice, and dal for the entire month. She is extremely happy with the Asha service and the 102 service, which helps her to go and get a checkup done on a regular basis. Her husband reported that government hospitals don't have proper testing facilities. There is a shortage of medicine. And a lot of times the staff of the public hospitals ask us to go to a private hospital because of this shortage, is what he mentioned. Now, let's understand this. Lack of resources in a public funded hospitals, like testing facilities, a lack of medicines, How are these affecting the people? Isn't that an increased cost for an underprivileged person to go to a private hospital and spend all their savings and earnings? We spoke to a corona affected victim and his wife. He is a forest department official by profession. His name is Mr. Shekhar and his wife's name is Vijay Lakshmi. When he got infected, he was admitted to a private hospital in Jadcherla, where he spent nearly 3 lakhs. But due to shortness of breath and deteriorating situation, he was later admitted to Nilima Hospital in Hyderabad, where he was in ICU for 17 days and spent nearly 17 lakhs. He was on oxygen support when we went and met him. His lungs were in a weakened capacity and he was advised to be on a continued oxygen support for the next 3 months. He could hardly breathe for 10 minutes without the oxygen support. One particular family spent nearly 20 to 30,000 rupees of the pension amount for the corona case. Many reported taking loans for the treatment. They also spoke about the availability of the doctor, which is only between 10 a.m. to 12 p.m. Some of the women mentioned about the rude behavior of the staff at the PHCs. If this is the situation, the question we need to ask ourselves is how can how can such people who don't have 20 to 30 lakhs in their bank account or have any collateral in exchange as a support or have a fixed salary or a regular job are expected to pay this amount and treat themselves at a private hospital. We spoke to a sarpanch of the Tumpali village. He said only 10% of the population is vaccinated in the village. In the beginning, people were afraid of the vaccination, but now people want to get vaccinated, but there is a rush in the PHC. He also mentioned that it will be of great help if the authorities can bring the vaccines to the village itself. Next, we went to the village Jakaram. We spoke to some women and asked about the visit of Asha workers. The woman mentioned that Asha workers visit whenever they wish. There is no particular routine. Some of the women also spoke about how alcohol and mutton will cure corona. They are extremely satisfied with the services of Asha and 102 services. However, they are not very happy with the A&M in the village. She doesn't visit very often here. She visits only rarely, is what something the woman mentioned to us. This shows the lack of expectations of a quality service from even an ASHA worker. It is very contradictory to hear from from the woman that she is extremely happy with the ASHA service, and she also mentioned that the ASHA worker doesn't visit quite often and she visits whenever she wants. We spoke to a couple of people in the village and they mentioned that they would rather spend 15 to 20,000 on deliveries at a private hospital than go to a government hospital. Out of the 1260 people in the village, only 50 people were vaccinated. People are extremely afraid to take vaccinations because of the effect that it is showing on them. Some of them even mentioned about the lack of proper road facility to go to the hospital and many of them hesitate, hence, to go to the hospital. Sometimes going to the hospital can be a tedious task. A day's labor charge will be gone if a villager goes to a hospital. It's a lot of effort and it's a lot of resource effort. Lack of proper roads and transport and at the cost of finances, most of the villagers don't go to the hospital itself. We spoke to an Anganwadi worker called Shobha Rani. She mentioned that she regularly visits the women to take care of their antenatal care. She pointed out a very interesting aspect about double ration. She said that all the anemic women in her village are given double ration. The immediate question that popped in our minds was, how does a double ration or increasing the quantity of whatever is being given as ration will improve the anemic conditions of a woman? Isn't the quality of the food more important than the quantity? We met an Asha worker, her name is G. Santosha, who takes care of the antenatal care. She said that medicines and ambulance are all available, but one of the main issues at the PHCs is the washroom. There is no neatness, there is no regular maintenance. The patients sometimes go to the hospital, go outside the hospital for the washrooms in the open air. There is a lack of medicines, is something that she mentioned. We spoke to a pregnant woman called Namita. She said that even though she's very extremely happy with the Asha service, that they help in giving full assistance in the normal deliveries and in taking them for a regular checkup, she doesn't have a full understanding of COVID. She doesn't know the implications of what COVID can do to her child or to herself. On our way to the public health healthcare center, we stopped by and met an acting MPP. His name is S. Anjanelu, who's the son of S. Yadama, who's actually is the MPP of that mandal. We asked him a couple of questions. A very some of them are very basic questions. We explained to him the situation in the village and asked him what action have they taken so far. The MPP has replied to us saying that we haven't taken any action so far, but we are willing and we are ready to do something about this situation now. At that point, one of the thoughts that came to our mind is our public leaders really need to be very, very proactive in their approach. We really feel our public leaders need to be more proactive to figure out these governance gaps and collaboratively fix them before the crisis hits us again. We went to a PHC called PHC Kondurg. It was extremely unclean and unhygienic. We saw all kinds of medical waste lying around at the entrance of the hospital. Some of the inpatient beds were filled with dust. We met the Asha worker from Tumpali who bought the woman for her delivery at the PHC. We were lucky to see a newborn child. We wanted to inquire about the washroom issue that she mentioned previously. When we saw what the washroom looked like, we couldn't even stand 6 feet nearby to that washroom. It was extremely disgusting and extremely unhygienic. We met two health assistants at the hospital. Their names are B. Jangama and A. Lakshmi. They mentioned that they have done their work extremely very well. They visit the sub-centers of the village regularly, and they also mentioned that they have given all the required response or resource to the COVID positive patients. They also told us that that majority of the staff at the PHC are on contract basis. Finally, we asked them one question. What is the rating that they would give to a PHC between 1 to 5? Without blinking an eye, they responded 5 out of 5. When we highlighted the washroom issue, they avoided the question by saying, "We are doing whatever we can." When we asked them about the VHSNC, Village Health, Sanitation and Nutrition Committee, they were very clueless and took some time to respond to that question properly. This incident made us realize the defensive attitude of the public healthcare professionals. They lack ownership, and there is a sense of fear among them to share authentic information. And finally, we visited CHC Shadnagar, where while we were waiting for the doctor, we observed a couple was waiting there. We went and spoke to the couple and asked them certain questions. We realized that the woman was suffering from diarrhea. She mentioned that she was unattended for almost an hour. She had to use the washroom outside in the open area as there was no electricity inside the washrooms and the flush was not working. She also mentioned that the staff members are very rude and they don't have an option but to come to a government hospital as they cannot afford a private hospital service. We also realized that there is no lab testing facility at the CHC and the generic medicines shop was closed. We spoke to the medical officer, Dr. Surinder, about the current conditions and the responses from the village. He simply replied saying that it depends on patient psychology what they choose. People want for faster services, hence they go to a private hospital. They don't have patience, is what he replied. He continually defended by saying it is the choice of the people that they go to a private hospital and not come to a public hospital. Some of the top issues that we have seen in the PHC and the CHC are hygiene of the public hospitals is compromised. The attitude of public healthcare professionals towards people is not dignified, is not respectful. There is a lack of manpower and infrastructure at the public hospital. Some of our recommendations are we would wish to see a fully functioning washrooms at both the PHC and the CHC with a continuous water supply and electricity. We also expect a regular maintenance of the washrooms at both the hospitals. We would like to see the patients, whoever is visiting to the hospital, being treated with respect and dignity, irrespective of whatever background they come from. We would like to see the VHSNC committee, a very crucial committee on the ground, doing some decentralized work on the immunization process. All the vaccines can be made available at a village level where Ashas can administer the vaccine under the supervision of the Sarpanch. Local NGOs can be of great support in this matter. That's it from our side. Thank you very much for watching the video. If you like it, please do share it with others. Thank you.